here at Scotia Village. We are located down on the other side of the building in healthcare, so you guys don't see us as often as our healthcare team. But we are down there, and we are here to serve everyone from independent to healthcare. So we're going to get started. Today's in-service is going to be on strength and flexibility for our back and core as we age. Feel free, if you want to stop me at any time and ask questions, you can. We'll have time at the end. If you have questions that you don't necessarily want to ask in front of everybody else, I can be here as long as you need me to. So I'll stay at the end if you have questions that you don't want to ask out loud. Okay. So a strong core is the foundation for a healthy body. We will discuss the importance of consistent strengthening and flexibility of the back and core to avoid back pain and injury as we age. Anybody in here have back pain? That's what I thought. So I recognize several of your faces because we are seeing you for such. Okay, so we're going to talk a little bit about our back and core muscles first. So our back muscles, as you see up here on the screen, support for your trunk and spine. They assist in movement of the body, including head, neck, trunk, shoulders, and arms. Allow movement such as bending, twisting, flexing, and extending our back and neck. These muscles also assist us in sitting and standing up straight, so we consider these our postural muscles. Our core muscles, you see in the red up here, they stabilize the trunk while the arms and legs move, allowing you to complete important functional movements, getting up and down from a chair, in and out of the car, things like that. They stabilize the spine, stabilize the hips and pelvis, assist the spine with excessive loads, and supports the low back. So when we're bending and lifting those heavy objects, essential for good balance. And then the core muscles are the link connecting our upper and lower body. So when we think about our core, much like a tree and the trunk of a tree, that's our foundation, and we want to have a strong foundation. So I'm going to touch just a minute on spinal nerves, and you'll see later on in some of the injuries that you can get from back injury, or some of the problems you can have from back injuries. There are 31 pair of nerves branching out from the spinal cord, and these nerves carry out messages to other parts of your body so that we function the way that we function. Oftentimes, actually probably more times than not, when you guys come to see us for back pain and things like that, a lot of it is directly related to this. When you have injuries, you get nerve impingements and things like that going on, so you have referred pain to other areas of the body. What research says about muscles as we age? So after the age of 30, we begin to lose 3 to 5% of muscle per decade. Without proper strength training, you can lose up to 30% muscle mass between the ages of 50 and 70. Exercise is the best medicine for maintaining independence and preventing injuries. And even if you are already experiencing or have experienced sarcopenia, that's just age-related muscle loss, it is not too late to begin an exercise routine consisting of strengthening and stretching for flexibility. What are the benefits of a strong core and back? So prevention of injuries, pain management, improved balance and stability, improved posture, assurance that your muscles will support your everyday movements, and decrease risk from osteoporosis. So with pain management, you're less likely, when you strengthen your core, your back, you're less likely to have those muscle imbalances that cause a lot of that pain. As far as the strong core muscles, on here, what I'm saying about that is that your strong core muscles work together with your other muscles to keep you stable, keep your joints stable, and to keep you from getting injured. So a lot of you guys, when you come to us, you have knee pain and hip pain and all these other pains. And a lot of that is instability in the joint. So our job is not necessarily that we can correct all of that instability. It's to make all of the arthritic changes and things going on in the joint. It's to make you as stable as we can. It's to strengthen those muscles around those joints. And that includes the back as well. You may have some back pain, and our goal is going to be to strengthen and to get you flexible in those areas that surround whatever the joint is that's bothering you. In this case, we're talking about the back. Also decrease risk from osteoporosis. So regular exercise, research does say, reduces the rate of bone reduction, reducing your risk of fractures. So what are some signs of weakness and decreased flexibility in the core and back? Poor posture and difficulty correcting posture. Now, how many of you around here know somebody who has this issue? You see it every day. How many of you have this issue? This is a big one for us around here in this age group. Low back pain. A lot of hands were raised when I asked about back pain. Lack of power and stability in the upper body. So you saw in that diagram where a lot of our back muscles are up here, so that's going to affect our upper body. Difficulty walking upright without swaying to one side or the other. Anybody have? Difficulty walking without bending. We see this a lot, especially on a rollator. Difficulty with everyday tasks that require core strength. So that's like picking up groceries, standing up from a chair, or putting on footwear.
The hardest thing is getting something off the bottom shelf of the refrigerator.
Absolutely.
And then coming up on one hand. And so I'd like y'all to help get everything to tell and start buying refrigerators and have a higher.
Okay. That's a good point, because that does get hard. As we age, it gets hard to bend over. And of course, we're taught our whole lives to use proper body mechanics. So that bending, well, as we age, these joints down here start to give out, and that makes it a little bit harder to use those proper body mechanics. Okay, importance of flexibility in the back and core. So ability to have free movement without stiffness allows fluid range of motion for muscles to work efficiently. Like I was saying before, a lot of times you have those arthritic changes in your joints, and our job is to get those muscles and supporting structures around that strong enough that they stabilize that. And that's for this reason, because if we're starting to get shortened in those muscles and we're not getting that full range of motion, those muscles aren't going to work efficiently. Maximizes workout due to better muscle performance. Same thing. If you have your full range of motion and you're not limited anywhere, you're going to get more from your workout when you're doing your strengthening exercises. Decreases pain related to stiffness. Anybody have stiffness around here? Decrease risk of injuries and improve posture. So common back injuries relative to weakness and lack of flexibility. So we've got muscle strains, disc injuries. Typically those disc injuries come from compression on the disc. Low back strain, vertebral fractures, pinched nerves, and muscle spasms. These are some more common injuries that we see, and a lot of these are just part of the aging process. The important part is that we're doing our strengthening and flexibility to reduce the risk of these, although that won't always 100% keep these things from happening. As we age, we're going to have some degenerative changes, a lot of us, and that's changes in the disc and joint space in our back. Of course, a lot of times, I think we outlive what our back was meant to, the length of time our back was meant to give us. So as we age, we start to see that. Spinal stenosis, narrowing of the spinal canal, typically from arthritic changes and disc degeneration. Spondylolisthesis, that's the slipping of the vertebrae forward or backwards. And all of these, most of these, in some way, are going to impact those nerves that we looked at earlier. So that's where your referred pain comes from, when you're having sciatic issues, when you're having those neuropathies and things like that. That is from nerve. So what can I do if I'm already experiencing issues or injuries? So you got a couple of options. So physical therapy, of course, and in the last 6 months, we have seen a huge increase in back-related problems. More than, I've been here almost 6 years, and we've seen more in the last 6 months than I have any other time in my 6 years here. So, rest, of course, if it's an acute injury, if it's something that just happened, you're going to want to rest. Cold and heat, and same thing. So if it's an acute injury, it's not something you've had for months, you want to use cold. Something you go home today, you bend over and, oh, you can't get back up. Tomorrow you feel it. You want to use cold on that. You don't want to use heat, because that's going to cause the inflammation to be even worse. A week into it, you may decide to do heat. Or you may decide to do a combination of heat and cold. Medications. NSAIDs are often prescribed, and of course over the counter or prescribed. But be sure that you're checking with your medical provider. Don't just go out and decide, I'm going to take what I've got in the cabinet. Make sure it's not their ingredients to it, so it's not something that's interacting with any of your other medicines. And it's the most appropriate thing for you. They may say, no, that's probably not what you need this. So you always want to talk to your physician, and then to seek medical attention from a doctor or back specialist. Now, which a lot of you have, and we all know kind of the road that insurance requires us to go on with that now. So most of you go to the doctor, and what's the first thing they're going to tell you to do? Physical therapy. They're going to send you to us. Even if they know that what you have going on we can't necessarily fix, they know we can strengthen, we can try and get you more flexible. We can't fix the actual problem. And they know that. But insurance requires us now to do all of these things, to go through the injections, to go through the physical therapy and all these MRIs and all these other things before they do anything else. And that's a good thing. I don't know anybody who wants to jump right into a surgery. So you have options like acupuncture and steroid injections and things like that before surgery. And then usually the next thing, if none of that works, is surgery. And none of us want to have to go through that unless it's absolutely necessary. What should I do to assist with my back and core health? So, proper body mechanics. Avoid heavy lifting if possible. There are lots of people in your community that can help you. So I can't see any reason that anybody in here needs to be lifting anything heavy unless you're just being impatient. And a lot of times that happens, and that's what causes injury. You got neighbors, you got people that work here that can help you, so reach out to your resources. Don't be lifting heavy things. And then the body mechanics, and like I said earlier, we're always taught to use our body mechanics. That does get more difficult as we get older. The joints that help us to do that start to bother us. So it makes it hard. So that's where physical therapy can also help. We can help you figure out how we're going to compensate for that and how we're going to keep you from getting injured worse or doing things that are causing you to hurt. Get involved in a consistent exercise, which may include resistance training and weightlifting. Now, I don't mean you're going in the gym and lifting 50 pounds. you're going to start out low and then you're going to work your way up. And of course, that's what Sarah and in wellness and physical therapy are for. We're going to help you with that. Begin a stretch. Did somebody say something? Okay. I thought I heard somebody start to ask a question. Begin a stretching routine, aiming for every day 10 to 15 minutes of stretching, but no less than 3 days a week. And then be mindful of your posture and correct it when needed. So a lot of hands went up when I asked about posture. So that tells me that we are seeing that and maybe being mindful of it, but maybe try to remind yourself even more. Now that you're listening to this, you're probably going to think about it a little more every time you lean forward. But try to get yourself in the habit of, when you notice you're bending forward, straighten up. Go into a corner in your house and stretch out a little bit. Do something to help you get that posture better. So what opportunities do I have at Scotia to improve my back and core wellness? Of course, physical therapy. So PT can assist in finding an exercise program that is right for you, specifically if you already have concerns regarding a program because of specific deficits or pain. We would assist you in adapting a program that is beneficial for you without eliciting increased pain or issues. We all typically, 9 times out of 10, when you come to us for back issues, we're going to end up using some of these other modalities. We're going to get that. Our goal is to try to get that calmed down, the back pain, the thing that's causing you the most trouble, is to get that calmed down, and then work our way into stretching and exercises and get you on a program that you can be consistent on. We use heat, we have ultrasound, we have e-stim. And we also use manual manipulation, massage, things like that. And then, of course, Wellness Center. So you have Sarah, and she may work with you one-on-one to find what classes or individualized programs are best for you. She can assist you in getting plugged into one of the many wellness classes that target back and core strength and flexibility. We're going to talk about some of those. So classes offered at Scotia. And of course, this isn't all of them. I just chose some of the ones that I thought would be really beneficial for your stretching and your balance, your core, your strength. So Tai Chi, of course, Mr. Robley teaches that, and he teaches that if you feel like you have trouble on land, on dry land, he also teaches that in the pool. So that may be a good place to start. Is to get in the pool and try it there and then work your way up.
The Tai Chi, which is in the pool, is almost entirely core.
Look at that. So great place to start. If you are able to get in the pool, great place to start. If you're worried about doing it on land, some people would be, because it requires some balance, it requires some flexibility. So some people would be a little more worried about doing that on land. The pool is a great place to be. If you can't swim or you're afraid of water, because we have encountered that here, you can do that in a depth that you're going to be safe in.
It's all standing, no swimming.
There you go.
Don't have to get your hair right now.
You don't. The hardest thing you have to do is get out of the pool with a wet bathing suit on and get undressed. So otherwise, that too. Morning stretches. So this focuses on flexibility through full body stretching. Gentle stretching focuses on posture, balance, and flexibility. Water aerobics, that's stamina and strength through the resistance of water. Any specifics you want to add? Any classes or?
Those are the top ones.
You think those are? Okay. And I'm going to plug this in there because I know some of you have had the opportunity to go down and check out this new machine. Some of you may not have went and checked it out, but I would highly recommend it. It's focused on balance, but as we learned earlier, our core strength is what we're looking at with balance. That helps us to become more stable. So when you go into, oh, you're gonna plug? Okay, so when you go in to do, Sarah can set you up, or if you're on therapy or want to be on therapy, when you're with us, we can also do that. So you just talk to Sarah if you're not on therapy, or you can talk to me if you want to do that with therapy. We can get you down there, we can get you set up on it. And then what our goal is for you to be able to do that by yourself, to go down. And we understand some people won't initially be able to do that. But ultimately, we want you guys to feel comfortable going down there, getting on the machine, and being able to use that freely.
What are the hours, or can you go down there any time, day or night, down in the gym? Somebody asked me that, I didn't know.
Yes, sir. There's no set hours that it is open. It is just open. So if you're a night bird and you're awake at 2 o'clock in the morning, and you just I want to get a pump in, you go and do it. So absolutely, you can go down there anytime. A little bit more information about the balance machine. So my goal is to get 100% of independent residents to get assessed on this balance machine. It's going through 2 assessments, and it gives you if you have a fall risk, and it gives you recommendations of activities that you can use on the machine that could help your specific shortcomings and ways that you can, and it gives you suggestions on muscle strengthening, and that will open the door for us to talk about putting a plan together, and I would love to do that individually. But there is a sign-up sheet in the blue book under, I have my own wellness tab. I have to put in a new sign-up sheet for next week, but it takes about 20 minutes or so to go through the full assessment and for us to talk about it. So I would love to open that communication with you to try to better our balance. This is going to be an annual thing. So similar to like the senior fitness test, where we do that every wellness week, this is going to be done every fall. So it keeps track of your scores, and then we can compare yearly. And if there is maybe a component that we are needing intervention on that is maybe a deficit from the previous year, then we can talk about physical therapy to really fine tune where those issues are. But get up with me.
Sarah, when you refer to physical therapy, do we have to have a physician?
You have to go, oh, go ahead.
We have to have a physician's order. Sarah can help us start that process by getting in touch with us. That's a good question, so, because a lot of people don't know how to get to us. So you can, if you have a doctor's appointment coming up and you know that, you can always ask your doctor, hey, I'd really like to get in with physical therapy. Can you write us that order? Of course, if you're with our elder care, who is our physician here, those are pretty easy for us to get. We just ask for it, and typically they grant that for us. Sometimes, if you don't have an appointment coming up, depends on who your physician is, but Kathy is in good connection with a lot of the physicians around here. So sometimes she can shoot over a message to them and say, hey, we've got such and such that would like to get in with physical therapy. Can you help us by sending us an order? Some of them will, some of them will not. Some of them will say, I want to see them before they do that. Yeah. So Sarah can help us by saying, hey, such and such wants to get therapy, and we can kind of talk to you guys, talk to Kathy, and figure out what our best route of getting that order is.
Be sure you tell them that you want the physical therapy done at Scotia,
That's
because if they say speak in physical therapy, they'll send you to the hospital.
That's a good point.
So let's get it done here.
Right. That's a good point, because we've seen that a lot lately, and thankfully you guys are seeing that as well, and a lot of you are saying, no, I don't want to have to leave off of campus to go over to the hospital. Some people may prefer that, and that's okay. We would love for you to come and see us, but if your preference is to go to the hospital, that's your right. But yes, we do see that, and thankfully people are catching on and are saying as soon as they send it, no, I live at Scotia, I want to do my therapy there. I don't want to have to come off campus to have my therapy. Okay, so personalized one-on-one session to establish the exercise program. So this would focus on setting up a program to target your specific needs. So again, it may include a variety of equipment, weights, just body weight. Sometimes there's no weights needed. This would be personalized to you, to where you are right now in your fitness journey.
Now, real quick, I understand that not everybody enjoys going to the gym or doesn't feel comfortable doing it. And there are a ton of exercises that you can do in your home. So you don't have to come and use all the machines if you don't feel comfortable doing that, but that it is an option. So if you wanted to strength train, which I would recommend 100% of people strength training, then we can talk about other options.
Okay, and maybe set up with Sarah if no current issues. So if you're a fairly healthy person, you're not having any back issues, Sarah is the person to see. You go to her, she can help you get set up, and you guys can work on something that suits you. In the case that you are having issues, and if you have not already been referred to us, which several of you have, but if you have not, you'll want them to refer you to therapy. Let us work with you, try to figure out what's going on, get you going, and then get you in a program after therapy. Now, I'm gonna say this too, because I have seen this a lot and you guys are gonna know who's guilty and who's not. So you come to therapy, we get you better, and we get you set up on an exercise program. 6 months from now, you come back to us and we say, have you been doing your exercises? How many are gonna say yes? Only a handful, I can tell you from experience. So when we set these up, this is something that we, even though we don't love to exercise, none of us, well, I personally don't love to exercise. Sarah personally does love to exercise. So for those that don't, it's hard to keep ourselves motivated. But at this age, it is imperative that you keep yourself in the best shape, because that's going to help you. If you live to be 90 and 100, it's going to help you as you go through the process of aging, if you'll get on it now and consistently stick to it. It doesn't mean you have to go to the gym 7 days a week. Like Sarah said, there's things you can do in your home. Three times a week. Start at 3 times, and then if you feel good about that, go on up to 4 or 5 times. It's not, you don't have to feel like you're training for the Olympics or bodybuilding or anything like that.
And walking is a wonderful exercise.
It is.
Do your walking, but also add some kind of strength component to it. Okay, walking is great for osteoporosis. It's great for cardio. That's awesome. But it shouldn't be your only form of exercise. Okay, because that won't do much. It will do some for your muscle tone, but it won't do as much as strength training, strength resistance, and that won't do as much for your back as strength training and strength resistance.
So I typically don't give out exercises, but I decided today that I was going to give you a few just basic, and you can look these up online. This is, if you come to physical therapy, 9 times out of 10, we're going to start with something like this. This is one of the most important core exercises. And again, I'm going to say this because I don't want anybody going out doing that and then getting hurt and coming to me and say, you told me to do that, now I'm in worse shape. So these exercises would be for somebody who has no known back issues, okay? If you have back issues, this might not be what you need to be doing, so don't go out and do this and then come and say, you caused me more pain. So you will need to seek further clearance from a physician or PT prior to completing these if you have pre-existing back conditions. But abdominal bracing is one of the first things you want to do for core exercises. And that's simply, you can do this in the morning before you get out of bed, at night when you lay in the bed. But what you want to do is you want to bring your belly button towards your spine. And you want to hold it there. Now, for most of us, it's going to feel like we're holding our breath. So what I tell people is to count out loud. Count to 10. You're counting 10-second holds. Count to 10 while you're doing that. Now, once you get that down pat, that's when you start to add to it. You can add other movements to it, but this is what you want to do. For every abdominal exercise you do, you want to start here. Okay?
Can you do it in bed?
You can do it in bed. You can do it in bed. Of course,
I have trouble getting on the floor and getting up.
that's what I was going to say. And a lot of people, that's a good point. A lot of people think that abdominal exercises have to be done on the floor. They do not. You can do abdominal exercise sitting, standing, on the bed. Everybody, well, not everybody, most everybody sleeps in bed, in a bed. So they can be done in the morning before you get up, in the afternoon when you lay down. But this is a good place to start. As you get this down pat, you start adding things to it like this. So you start keeping that bracing while you're doing this, right? This makes it harder. This is the next step. And then you're going to bridge. So you're going to lift your bottom up off of the mat, the bed, wherever you are. I will say, the more firm surface is better. You can do this on the bed, but the firmer the surface, the better this is going to be for you. And then things like abdominal bracing, and then for here, it shows this person with the band. You don't have to start with a band. You would bring your legs away from each other and back in while you're holding that belly button tight towards your spine. Okay, so those are just some general, like, starting exercises. These are more for flexibility, so you don't necessarily need to hold that abdominal brace. You want to lie flat, and these, again, are things you can do on your bed. You don't have to be on the floor to do these. This trunk rotation is a really good stretch for your low back. Some of you have probably done that with us. And then your knee to chest, that's another good one. So again, you can find, if you have a smartphone, a lot of you have iPads, a lot of you have computers, you can look up and find a plethora of just generalized exercises for the core and back. Of course, we want to give you something more suited for you. So we don't necessarily recommend that being all that you do. We recommend you come and find Sarah, find therapy, find somebody that can help you get plugged into a more consistent something that's going to work for you, because that's the other thing. We want to find something that you will do. That's the big thing. We don't want it to be so hard that you don't do it. We want you to be able to complete the exercises and the stretching, all those things. Okay, that's just a few of the resources I used. Okay, so I will open it up for question and answers now, if you guys have anything you want to.
Okay, I got a question that's kind of off that subject, but height loss as you age, what causes that?
A lot of times osteoporosis. It's the bones getting more dense and causing us to shrink.
So how do you correct it?
You can't. That's why it's important to do this as soon as you can. It's important to get on the strengthening and the flexibility, because that will help you decrease the rate at which that happens. But it's not, osteoporosis isn't something that we can correct. It's one of those, the things that I talked about as like just part of aging. It doesn't happen to everybody, but some people more than others. You want to plug anything in there? You got any advice that you want to plug in to that? He asked, like, how do you stop osteoporosis? Eunice is our PT, so she's been back there listening to me. So I'm going to let her chime in.
Hi, good afternoon. As far as stopping it, we really cannot stop, like what she said. But as far as like doing exercises to load your joints, it will help strengthen those bones in a little way that will kind of delay the process of being worse as far as the bones weakening and breaking.
Right.
So these flexibility exercises and strengthening exercises will have a big benefit on your body for your age. Thank you.
Anybody else?
Do calcium supplements make a difference in terms of slowing down osteoporosis?
I can't answer that 100%. She asked, do calcium supplements help with that, slowing down the process? And I don't know 100% that. I know it is recommended by a lot of physicians, especially for women. I don't know 100% though.
We're talking about everybody bending over. Just about everybody.
Uh-huh.
We're talking about everybody bending over. What do you think of the new, the walkers, the upright walkers?
I think those,
What? Oh, the upright walkers.
what she's asking is what I think about those upright walkers. They are great for
And-
those who need them.
And how about a camel cane? You know what a camel cane is?
I do not know what a camel cane is. I'm like,
Well, we have one, and Ralph won't use it, but I
Okay.
ordered it for him. But I'll show it.
well,
to
we're
you
gonna have to
sometime.
check that out when we
Yeah.
come out
It's
there.
more, it's taller, and the way you hold it is better, and it's got a thing down at the bottom that balances better.
Oh, okay. So probably
I
like
saw
our
a
quad
lady when I
canes.
saw a lady using one when I went to get an MRI, and I asked her what it was. I immediately ordered one.
Okay, well, I'm gonna have to come and see that because I don't know what a camel cane is without you describing it. I probably could. I'll have to check that out. But I will tell you, there are lots of different walkers, and finding the right one for you is important because it does. What we see a lot of times is folks go. Mr. Robley and I were talking about this before we started, but a lot of folks just go to the rollator. That's their go-to. They don't want to go to a two-wheel walker, so they automatically go to the four-wheel walker. 9 times out of 10, that's the ones we see. That is not necessarily the walker for you. So we have recommended those upright walkers to folks, and they have gotten them. Some like them, some don't. Typically, oh, okay. I don't think I've ever seen that, but that's interesting. So we can definitely, if you have questions about a walker, we would much rather you come and talk to us and ask us about it before you just go out and buy one. We want to make sure you guys are safe around here. And of course, our goal is that you don't have to use a walker. But if we get to that point, let us help you figure out what's right before you just go and buy one. A lot of people jump on those rollators, and before you know it, a month down the road, we're picking them up off the floor because that's not really what they needed. They get out from under you quickly, and that's a big issue, and people don't realize that. They just see it and they think, oh, that looks like a nice walker, and they go out and buy it, and next thing you know, we've got a hip fracture. So let us help you guys if we get to that point that we need to start picking out walkers. And of course, typically, if we get to that point, in therapy, we have, well, if you've been down there, you see we have lots of things, and a lot of times people are donating these things to us, so more than we have room to store. So a lot of times we have rollators that we can try with you before you go out and buy one. Rollators, canes, regular walkers, I mean, we have all kind of stuff, so always make sure you're asking us. You don't necessarily need to go out and buy it, because what happens is we get so much of it, somebody donates the next thing and I take it right over to Habitat because we don't have space for it. So always, if you guys have a need for any kind of medical equipment, just ask us ahead of time to make sure you're not spending money needlessly. Anybody else? All right, thank you, guys. You're very welcome, and like I said, I'll hang out here, so if anybody wants to ask a question that they didn't get to ask or don't want to ask out loud, I'm here. Come talk to me. That's good. This was a great turnout. Great.